The Child and Family Services Review, or CFSR, Round 1 data showed there's a strong association between caseworker visits with children and several other areas of safety, permanency, and well-being. This association suggests that when workers make concerted efforts to establish frequent contact with children, they often make the same effort to establish frequent contact with the parents. In other words, cases that scored a strength rating in caseworker visits with children also scored high in the areas of risk assessment, safety management, needs and services of children, parents, and foster parents, involving children and family in case planning, and caseworker visits with parents. Today we'll look at an overview of caseworker child visit requirements in Children's Protective Services Policy and cover the importance of documenting visits correctly in the Services Worker Support System, SWSS CPS. This will ensure important elements of your visits are captured in the data DHS uses to measure Michigan's progress towards federal and state goals. Entering contacts accurately and completely allows them to be included in the data reports important in tracking caseworker visits needed for the CFSR, Program Improvement Plan, and the Consent Decree requirements. Many of you have asked, what do I need to do to make our visits count? Very simply, just follow the current CPS policy on caseworker visits in quantity and quality, and you'll meet all the requirements. Let's move on to CPS policy on caseworker child visits. This video reviews CPS policy for ongoing cases, not investigative contact requirements. Each child must have a face-to-face visit a minimum of once each calendar month. The majority of visits must take place in the child's residence. Each visit must include a private meeting between the child and the CPS worker. During the monthly visit, the areas to be discussed must include, but are not limited to, information outlined in the CPS Caseworker Child Visit Reference Guide and Tool, DHS 903 and 903A. For example, discuss information about the child's needs and services, permanency plan, school, and safety concerns. And the information gathered during the monthly visit must be documented in the updated service plan. For CPS policy on in-home cases, visit requirements are based on risk level. If the risk level is low, CPS workers must have one face-to-face contact with the family and one collateral contact per month. If the risk level is moderate, CPS workers must have two face-to-face contacts with the family and two collateral contacts per month. If the case is high risk, CPS workers must have three face-to-face contacts with the family and three collateral contacts per month. When the risk level is intensive, CPS workers must have four face-to-face contacts with the family and four collateral contacts per month. In the first month of service provision, an attempt must be made to have at least one face-to-face contact that includes all children and all caretakers residing in the home. If you're planning to close the case, the CPS worker must have contact with all the children in their home at least 30 days prior to case closure. Remember, service providers, including Family First workers, cannot replace all the monthly visits. CPS workers must make at least one visit per month. For example, if the risk level is high, the Family's First worker can make two face-to-face contacts with the family and children, and the CPS worker must make one face-to-face contact, which totals the three required face-to-face contacts. We're focusing on caseworker visits with children in this training. However, it is important to note CPS policy also has requirements for collateral contacts that we are not covering today, but they are important to the case plan. Let's look closer at the 903 and 903A forms that are available as Microsoft Word templates. These forms are designed to assist caseworkers by listing key components to be reviewed during visits with children and their caregiver. The 903A guide can be referenced, and the 903A can be used to jot your notes from the visit as a reminder when documenting the information in SWSS. The 903A is not to be used as documentation in the case record, and the information from the visits must be included in social work contacts and service plans. The 903A form is not mandatory, therefore there is no requirement for it to be filed in the case record. Let's talk about the importance of timely entry of caseworker visits in SWSS CPS. Prompt entry of all case contacts in SWSS enables DHS to accurately measure our performance in the area throughout the year. The number of days allowed to enter visits into SWSS is changed to within 5 business days. All visits between caseworkers and children are entered in SWSS CPS. Remember to enter visits for the first month the case is open and the last month prior to closing the case. CPS workers will document the family's first worker contacts in SWSS, showing the visit occurred, briefly summarizing the visit, and referencing their report for detailed information. Although cases may have varying permanency goals, a quality visit should include an opportunity to speak privately with the child and complete an assessment of the child's needs, safety, and well-being. It must also include evidence the child's needs were met through a service referral and/or repeat visits as appropriate. Both policy and the 903 and 903A review key topics you should discuss during your visits with children, which assist in completing a quality visit. You may not always review all of the topics noted during each visit, but it is essential to document all the areas pertinent to a particular visit, and overall you must address all of the key topics in the service plan. So you ask, where do I document the quality information for monthly visits? You will enter the details of areas reviewed at the visit in SWSS CPS in the Social Work Contacts section. In the Contact Comment Narrative field, you have space for 14,500 characters to describe how the client or family was engaged in service planning by including an explanation of the family member's perception of the safety concerns that led to CPS involvement, the family's ideas of the areas that need strengthening to improve the safety of the children, and a description of the services that were offered to improve safety, as well as the family's responses or preferences. Before we open SWSS, I want to share this tip. If you have shortcuts or desktop icons for SWSS, you are not guaranteed to receive updates or downloads on SWSS CPS. Therefore, you should delete any shortcut icons and only use the Start, Programs, and SWSS CPS path to access this database. In addition to this video, the handout Accurate Documentation of Caseworker Visits in SWSS is available for you to reference at this link noted here. Let's take a look at how to enter caseworker visit data into SWSS CPS. To get started, go to the main menu, select a case, and then select Social Work Contact. To enter a social work contact, select Add New on the contact screen. When entering a social work contact, complete the date contacted and time contacted fields. Select Yes or No to the left of Print on Service Plan. You may select No when you do not want a contact with a reporting person's name printed on the service plan. The CPS worker must enter all contacts, either attempted or successful, into SWSS CPS, so select Yes or No for attempted contact successful. Select a contact method from the drop-down box. For our use, we will select face-to-face. Select the location where the visit occurred from the drop-down box. Select Other only when the location was different from the locations listed. Remember, per CPS policy, the majority of the visits with the child must occur in the child's residence, which include foster home and own home. The contact locations not considered the child's residence or placement include court, DHS, hospital, other, relative's home, and school. It is important to select the contact location and only use Other when the location of where the visit occurred is not one of the choices. For example, if you met with a child at a restaurant, you would select Other. All social work contacts with accompanying narratives will pre-fill into the initial and updated service plan. When your social work contact with a client or family includes engaging them in the development of the service plan, you must select the Engagement of Services box on the Contact Details screen. In the Social Work Contacts comment box, you'll document family engagement by describing the actions and discussions that took place during the visit regarding services offered to the parent or caregiver. Family engagement is key in the CFSR process, and documentation of this is significant in achieving the goals in our CFSR Program Improvement Plan. To add a person to the case contact list, click on either Add New Collateral Contact or Edit Collateral Contact. Then open the Add Update Collateral Contact box and enter the specific information about the person in the Select Contact box. In the Enter New Contact field, enter the person's name and be sure to include the person's relationship type, such as Families First Worker, Police Officer, not just their name. For example, Sarah Smith, Families First Worker. Make sure all contacts with a child are entered into SWSS before a CPS case is closed, as reporting information is also collected on closed cases. It is important to close cases timely in SWSS within the calendar month the case actually closed. The expectation of visiting each and every calendar month continues until the case is closed in SWSS. Ultimately, entering caseworker visits with children in SWSS correctly is important to ensure that data reported accurately shows the progress Michigan is making towards achieving safety, permanency, and well-being for children. Let's review by taking a short quiz. Even though Families First Workers document their visits with families, the caseworker must also enter these visits in SWSS. True or false? True. All visits must be entered into SWSS. Which list includes only locations not considered the child's residence? Court, DHS, hospital, other, school. Court, DHS, hospital, other, school, foster home. Court, DHS, hospital, other, school, own home. The answer is court, DHS, hospital, other, and school. Foster home and own home are considered the child's residence. When entering a new contact in SWSS, it is important to enter the person's name and their relationship type, such as Families First Worker. True or false? True. You need to enter the relationship after the person's name, such as Sarah Smith, Families First Worker. Caseworkers must enter all contacts in SWSS timely and ensure all visits with the children are entered into SWSS prior to closing the case. True or false? True. Michigan also reports on closed cases, so be sure to enter all contacts prior to case closing.